Imagine living in a world where memories fade and the mind slowly unravels. Dementia, particularly Alzheimer's disease, is a devastating journey marked by memory loss and mental degradation. It robs individuals of their past, disrupts their present, and clouds their future. Diagnosing dementia early is crucial for managing its progression and maintaining quality of life. As we delve into understanding dementia, Alzheimer's disease, and their impact, we will uncover the importance of early detection and compassionate care in navigating this challenging path. So let's dive straight into it. Alzheimer's disease, AD, is the most common cause of dementia, affecting 30 million people worldwide. The World Health Organization projects that this number will triple over the next 20 years. The cumulative incidence of Alzheimer's dementia increases from about 5% by age 70 to 50% by age 90, making it a prevalent condition. As life expectancy rises and populations age, healthcare systems will face increasing pressure unless a cure or effective therapy is found to delay the onset of dementia by 5 to 10 years. AD is a polygenetic neurodegenerative disorder characterized by the progressive loss of synapses and neurons, leading to neocortical atrophy. This disease, first described by Alois Alzheimer in 1907, involves variations in genes such as amyloid precursor proteins, presenilin-1, and presenilin-2, which can directly cause Alzheimer's. These genetic variations often result in early-onset dementia in individuals in their 40s and affect entire families, particularly those with trisomy 21. However, this form of Alzheimer's accounts for only 1% of all cases. The remaining 99% of Alzheimer's cases are sporadic and primarily affect individuals over 65 years old. These patients inherit 60% to 80% of their risk for late-onset AD, with the remainder influenced by environmental factors. In late-onset AD, many different genes, some still unidentified, contribute minor fractions to the overall risk, illustrating a potential case of antagonistic pleiotropy. Recent genome-wide association studies have identified new genetic candidates for AD. The best characterized genetic risk factor for late-onset AD is the apolipoprotein E4, ApoE4, genotype. Carriers of the ApoE4 allele have a 4 to 10-fold increased risk of developing AD. The ApoE4 allele is an ancient variant, while the more recent ApoE2 and ApoE3 alleles emerged less than 200,000 years ago. ApoE3 is the most common allele, present in about 60% of human populations, while ApoE4 is found in approximately 10%. The rapid prevalence of ApoE2 and ApoE3 suggests they confer advantages such as higher synaptic plasticity and repair capacities. This selection bias might also be linked to human adaptation to a diet rich in meat and animal fats, which could have favored the ApoE3 allele. Causes of dementia. Dementia is caused by various diseases that damage brain cells, interfering with their ability to communicate. When brain cells can't communicate normally, thinking, behavior, and emotions are affected. The brain has many distinct regions responsible for different functions, like memory, judgment, and movement. Damage to cells in specific regions disrupts their functions. While most brain changes causing dementia are permanent and worsen over time, some conditions causing thinking and memory problems may improve with treatment. These conditions include depression, can cause memory and concentration problems, which may improve with therapy and medication. Medication side effects. Some drugs can impair cognitive function, and adjusting or changing the medication can resolve these issues. Excessive alcohol use. Long-term alcohol abuse can lead to brain damage, but cognitive function may improve with abstinence and treatment. Thyroid problems. Hypothyroidism or hyperthyroidism can affect cognitive function, but treatment can often reverse these effects. Vitamin deficiencies. Deficiencies in vitamins like B12 can cause cognitive issues, but supplementation can restore normal function. Diagnosis of dementia. Diagnosing dementia is complex and doesn't rely on a single test. Doctors diagnose Alzheimer's and other types of dementia by gathering a thorough medical history, conducting a physical examination, running laboratory tests, and observing the characteristic changes in thinking, day-to-day function, and behavior associated with each type. They can determine with high certainty that a person has dementia, but pinpointing the exact type is more challenging because symptoms and brain changes can overlap. Recently, work groups from the Alzheimer's Association and the National Institute on Aging have introduced new criteria and guidelines for diagnosing Alzheimer's disease, or AD, replacing the previous guidelines from 1984. This significant update incorporates advances in our understanding of the disease. Key changes include the use of biomarkers like hippocampal atrophy and the formalization of earlier disease stages such as mild cognitive impairment due to AD and the newly defined preclinical AD stage. These recommendations, while primarily for research purposes, aim to diagnose the disease earlier, as early intervention is crucial for successful treatment. However, this new approach might classify many older individuals as having the disease, given the increasing prevalence of AD in the elderly. Scientifically, it might be more intriguing to investigate why some individuals do not develop AD despite aging. Clinically, patients may initially present with subjective concerns about cognitive decline. This can progress to mild cognitive impairment with abnormal neuropsychological test results, and eventually to dementia, where daily activities are significantly impaired. As brain atrophy advances, other psychiatric and neurological symptoms emerge, and patients often lose weight and develop swallowing difficulties, potentially leading to aspiration and pneumonia, which is frequently the final cause of death in demented patients. Neuropsychology of AD consensus exists that AD clinically starts with memory complaints, affecting episodic memory, speech production, and visual orientation. Memory is the process of encoding, storing, and retrieving information, and it can be categorized into short-term versus long-term and implicit versus declarative memory. Short-term memory, dependent on the frontal and parietal lobes, lasts only seconds to minutes. In contrast, long-term memory has a nearly limitless capacity and duration, relying on new protein synthesis and changes in neuronal networks. Declarative memory, which includes semantic and episodic memory, is often first impaired in AD. Semantic memory loss affects language, verbal fluency, and naming, and can occur years before diagnosis. The hippocampus is critical for consolidating short-term to long-term memory. Its destruction prevents new memory formation. Clinicians use neuropsychological test batteries like CIRAD Consortium to establish a registry for Alzheimer's disease, the Mini-Mental State Examination, and the Clinical Dementia Rating Scale to assess various cognitive domains. AD patients typically show impairments across multiple cognitive areas, with progressive decay of working memory and increased sensitivity to distraction. Current medications for AD, such as acetylcholinesterase inhibitors or memantine, improve attention and concentration, primarily in mild to moderate stages. Deficits in attention and working memory due to damage in frontal subcortical circuits also impair executive functions like planning, problem-solving, and goal-directed behavior. Tests such as the Wisconsin Card Sorting Test, Stroop Test, and Tower of London Test assess these functions, with impairments indicating progression to full dementia. The Boston Naming Test evaluates the ability to name objects, with cued recall deficits closely associated with cerebrospinal fluid biomarkers indicative of AD in subjects with mild cognitive impairment. The Clock Drawing Test and Trail Making Test. A+B assess visuospatial processing, mental flexibility, and executive functioning, with AD patients showing early difficulties in these areas. Memory loss with dementia. Memory loss can be a symptom of any type of dementia. For people with Alzheimer's disease, it is often among the very first signs. Memory can be affected in different ways. These include not being able to create new memories. This means that recent events are not recorded in the person's memory and so cannot be recalled later. For example, the person may forget a conversation they have just had. Taking longer to retrieve information. This means that even though the person is still able to recall things, this takes them much longer, or they might need a prompt. For example, they might need more time to find the name for an object. Not being able to retrieve information, this means that even though the person may be able to create new memories, they are not able to access them when needed. For example, they may get lost in familiar surroundings or on journeys they have taken many times. Memory loss affects everyone differently, but many people with dementia experience some of the following: forgetting recent conversations or events, sometimes referred to as short-term memory loss; struggling to find the right word in a conversation, forgetting names of people and objects, losing or misplacing items, such as keys or glasses; getting lost in familiar surroundings or on familiar journeys, forgetting how to carry out familiar tasks, such as making a cup of tea; forgetting appointments or anniversaries, not being able to keep track of medication, and whether or when it has been taken, struggling to recognize faces of people they know well. These changes may be more visible to family and friends than to the person themselves. Navigating the realm of dementia, particularly Alzheimer's disease, is a journey fraught with challenges like memory loss and cognitive decline. Early diagnosis is pivotal for managing its progression and preserving quality of life. By understanding the genetic underpinnings, diagnostic complexities, and impact on memory, we underscore the urgency of research and compassionate care. As we continue to delve into these intricate aspects, we strive towards improved therapies and support systems, offering hope and dignity to those affected by this devastating condition.